Medicare. Established in 1965, it is targeted to provide healthcare insurance to people aged 65 and above, regardless of income or medical history. Today, it covers 55 million people. Medicare pays about 50% of the fees. The remaining is funded through supplementary. To qualify for free Medicare Part A, you need to be 65 or up, U.S. citizens or legal residents of U.S. for at least 5 years, and either you or your spouse has paid Medicare taxes for at least 10 years. Under 65 but with disabilities, permanent kidney failure, or Lou Gehrig disease. If you're purchasing Medicare the first time, there are a few things you need to know to get it right the first time. When to enroll, what to buy, and what's covered. Decision points. There are two paths to Medicare, Original Medicare or the Medicare Advantage. Original Medicare is run by the government. It includes Part A, hospital, Part B, medical, and an optional Part D drug coverage. Many people also buy Medigap, a supplemental insurance to cover copays and deductibles. Another type of Medicare health plan is the Advantage Plan or Part C. It is offered by private insurance and functions like A and B, and many includes prescription drug coverage. They offer HMO, PPO, fee-for-service model, and special needs plans. Note, if you join Medicare Advantage, you can't purchase Medigap Policy. Why Medicare Advantage? It is one plan for everything, covering hospital, medical, and drug. Can include dental, vision, and hearing. Foreign travel, max out-of-pocket limits, features missing in the original Medicare. Can be cheaper than getting Part D and Medigap. Do they have doctors you need in the network? Compare features at this site. Eligibility. For most people, Part A is free. If you're 65 or above, either you or your spouse has 40 quarters of Social Security income, resident or citizen of US for 5 years, Part A is free. If you need to buy it, the premium is $411 per month or $266 if you have between 30 to 40 quarters of Social Security income. Part A, hospital. What is covered? It covers hospital, skilled nursing, short-term only, nursing home care, hospice and home health service, long-term care and custodial, bathing, dressing, etc. are not included unless medically required. Deductibles and copays. The deductibles are made on each benefit period. A benefit period is defined as the time you start receiving benefits and ends when you've stopped receiving benefits for 60 days in a row. In our example, after the first 60 days of no treatment, the second benefit period starts on April the 1st and the new deductible is due. How do you pay? Any hospital stay 60 days or less, just a deductible, $1288. The next 30 days, $322 each. After that, it's the lifetime reserve days, total 60 days or $644 each day. And after that, you pay all costs. There's no max out of pocket. Think Medigap or Medicare Advantage. Part A, skilled nursing facility. Must be medically required. First 20 days, nothing. 21 to 100 days, $164.50 in copay. Over 100 days, all costs. If your break in skilled care lasts more than 30 days, you need a new 3-day hospital stay in order to qualify for additional care. Enrollment period. Initial enrollment. If you just turned 65, it starts 3 months before your 65th birthday. Includes the month that you turn 65 and ends 3 months later. General enrollment starts from January the 1st to March 31st. It is for people who miss the initial enrollment, but you might be subject to penalty. More enrollment dates. Special enrollment. For people who continue to work after 65, they have an 8-month window to join after termination. Join, switching providers within plans, October 15th to December the 7th. Switching back to Original Medicare from Advantage, January 1st to February 14th. When does my coverage start? It is important to know when your coverage starts so there is no gap in service. For initial enrollment, if you automatically enroll or enroll during the first 3 months of the enrollment period, your plan will start on month 4. If you enroll in the 4th to 7th month, your coverage will start 1 to 3 months after you enroll. Here's the chart. Other enrollment periods. For general enrollment, coverage doesn't start until July 1st. For all other enrollments, coverage starts best 1 month later. Be careful not to cancel any insurance until coverage starts. Note, COBRA and retiree health coverage don't count as current employer coverage. If you enroll late because of this, you'll be subject to penalty. Late enrollment penalty. It is important to know when to enroll because there's late penalty for not enrolling on time. This penalty applies every year that you have Medicare. Exception: you're still covered by your employer or your spouse employer because either one of you are still working. Part B, late enrollment penalty. Penalty equals 10% each year. Example, you're late 4 years equals 40%. If your premium is $200, you'll be paying $280, 40% more. Part D, late enrollment penalty. Penalty equals 1% each month. Example, late 4 years equals 48%. If your premium equals $100, you will be paying $148, 48% more. How to apply? If you're already receiving Social Security, do nothing. You'll be automatically enrolled. You can delay Part B by sending the Medicare card back. If you want to start or drop Medicare, or just start Medicare but not Social Security, contact Social Security, ssa.gov. Part B, medical. This is for preventive care and what is medically necessary. This includes clinical research, ambulance services, durable medical equipment, mental health, second opinion before surgery, limited outpatient prescription drugs. Part B, costs. There's a $166 deductible and a 20% copay, but no max limit. You might want to add Medigap if you have serious health needs, or consider Medicare Advantage to limit max out-of-pocket. Part B, premium. The premium is means adjusted and is dependent on your modified AGI 2 years ago. For 2016, most people will be under the first tier, paying $121.80. Part D, premium. It is also mean adjusted. Average premium for 2017 is $51.96 per month. Part D, drug benefits. It has $400 deductible. After that, a 25% copay up until 3007. Then you hit the donut hole where the beneficiary is responsible for 100%. When your expense exceeds $7,425, Medicare starts paying at least 95% again. Part D, drug plan costs. Your drug plan costs would depend on the drugs you use, the plan you choose, whether the pharmacy is in your plan's network, whether the drugs you use are on your plan's formulary. The best thing is to use the Medicare Plan Finder, type in your drugs and estimate the cost for Medicare Original or Advantage. Other things you should ask about since drugs are expensive: prior authorization, quantity limits, waive coverage restriction, tiered formula, which tier? Tier 1, preferred generic, Tier 2, generic, Tier 3, preferred brand, Tier 4, non-preferred drugs, Tier 5, specialty drugs. Medigap. It is a supplementary insurance to help copays and deductibles. There are 10 standard plans with different coverage features. Even if they are the same plan, premiums could differ depending on the issue and the state. Adding Medigap to Medicare Original allows you the flexibility not to be limited to in-network providers. Here are the 10 Medigap policies. They all provide an additional 365 days of hospital. Most cover all or big part of Part B coinsurance. Some include foreign travel coverage. Plan F is the most popular and most comprehensive, but Plan K and L has max out-of-pocket limits. Medicare Enrollment. The period lasts 6 months starting from the first of the month after you've enrolled in Medicare. Example, you turned 65 on April 3rd but didn't enroll in Medicare until May 25th. Your enrollment starts on June 1st and lasts 6 months till the end of November. If you miss enrollment, you still guarantee coverage, but not price. Credible coverage. Medigap might refuse to cover costs for pre-existing condition even when your coverage starts. You need to have at least 6 months continuous coverage from your previous healthcare plan before Medigap accepts your coverage. Part C, Medicare Advantage. It's offered by private insurance. It incorporates Part A, B, D, and Medigap. Part C runs in form of HMOs, PPOs, private fee-for-service plans, and special needs plans. May cover hearing, dental, and vision. May have out-of-pocket limits and foreign travel, but is additional premium over Part B. How do I pick? You have to know your doctors, know your drugs, Are they covered by in-network providers? Do you need hearing, vision, and dental? Do you need out-of-pocket limits and foreign travel? Compare Part C premiums against costs of Part B, D, and Medigap. Is that cheaper? Medicare Advantage Part C enrollment. Initial enrollment similar to Part A and B. General enrollment April 1st to June 30th. Open enrollment to add, drop, or change plans within Part C, October 15th to December the 7th. Switching back to original Medicare, January the 1st to February the 14th. Low income help. If you have low income and need help paying for Medicare expenses, contact Medicaid, Medicare Savings, PACE, Extra Help for Drugs, and SSI benefits. Let's wrap it up. Using a hypothetical example of a couple age 65, income under 170, opting for original Medicare, Part A is free, premium for Part B is $1,462, deductibles and copay are covered by Medigap Plan F, which costs $2,166. Adding everything up, total expense is $5,000. Conclusion: it is expensive. 20 years for an individual is $100,000, 20 years for a couple is $200,000, and that doesn't even include long-term care expenses. Here are the resources. Get prepared. It's an awful lot of learning, but we did it. Thank you. Contact us for help or additional learning.